Health, socioeconomic, and environmental consequences of tobacco use. Brief interventions for tobacco prevention and cessation in primary healthcare settings. Areas covered: the global and Sri Lankan burden of tobacco, types of tobacco products in Sri Lanka, nicotine dependence, impact of tobacco and secondhand smoking on health, economy, society, and environment. Learning outcomes. At the end of this session, the participants should be able to describe the health, social, economic, and environmental impact of tobacco and secondhand smoke. The following chart depicts the burden of tobacco smoking, the global situation. Tobacco kills up to half its users. It kills more than 8 million people each year. More than 7 million deaths are due to direct tobacco use. About 1.2 million are due to second-hand smoking. Tobacco kills more than 12,000 people a year. Accounts for 10% of all deaths. That is the burden in Sri Lanka. The burden of current tobacco use, both smoking and smokeless, among adults in Sri Lanka. 1 in every 4 persons currently use tobacco, smoking or smokeless tobacco. There is a higher risk among males. 1 in every 2 males. One in every 3 men currently smoke tobacco. Among children in Sri Lanka, 1 in every 11 students of 13 to 17 years currently use tobacco. A higher risk among boys, 1 in every 6 boys is present. Among school children, 1 in every 2 students of 13 to 17 years is exposed to second-hand smoke. Parents or guardians of 1 in every 5 students of 13 to 17 years use tobacco in the presence of their children. This shows the trend of tobacco smoking among males above 15 years in Sri Lanka. The types of tobacco products used in Sri Lanka. Smoked tobacco products are cigarettes, bidi, cigars, pipes, hookahs, and shisha. Smokeless tobacco products are betel quid chewing, tobacco chewing, barbel, snuff, thool, pan masala, and gutka. The health consequences of tobacco use are as follows: cardiovascular system, heart attack or angina, stroke or transient ischemic attacks, peripheral vascular disease, aortic aneurysm, diabetes mellitus. In the respiratory system, shortness of breath, exacerbated asthma, chronic obstructive pulmonary disease, respiratory infections. Cancers: larynx, oropharynx, esophagus, trachea, bronchus, lung, acute myeloid leukemia, pancreas, stomach, colon, kidney, cervix, and bladder. Eyes: blindness, cataract. Mouth: gum disease, cancer of mouth, lip, etc. Bones: osteoporosis, hip fractures. Reproductive system: impotence, infertility, miscarriage, premature birth, low birth weight. Economic consequences of tobacco use. At the time of carrying out this presentation, the direct cost for consumption is Rs 65 per cigarette into 5 cigarettes per day into 30 days per month, equivalent of Rs 9,750 spent per month, and for 1 year it would be Rs 117,000 spent on cigarette per year. The direct costs due to tobacco related illnesses, healthcare expenditure, hospitalization, physician services, medication, premature deaths, loss of productivity, opportunity costs. Social consequences of tobacco use are that it can affect personal relationships. Children of smokers are more likely to smoke and smoke more heavily, may result in child labor and exploitation. Environmental consequences: air pollution, deforestation for tobacco growth and curing of tobacco plants. Environmental degradation occurs as tobacco plant consumes nutrients from the soil due to the use of pesticides and fertilizers. Pollution of groundwater and waterways due to large and frequent application of pesticides. Cigarettes manufacturing waste and chemical waste. Cigarette butts are not biodegradable. Pollution by cigarette packages, lighters, matches, and other byproducts of tobacco use. Secondhand smoking. Secondhand smoke comprises of mainstream smoke, smoke passing through the back end of the cigarette, side stream smoke, smoke from the burning cigarette coal. Secondhand smoke contains more than 4,000 chemical compounds. There are at least 250 harmful chemicals, of which 69 are known to cause cancer. Adverse impacts of exposure to second-hand smoking. Diseases in children, sudden infant death syndrome, acute respiratory disease, middle ear disease, chronic respiratory symptoms. Diseases in adults, cardiovascular diseases, nasal irritation, lung cancer, reproductive effects in women. Third-hand smoking. Third-hand smoking consists of residual tobacco smoke pollutants that remain on surfaces, such as clothes, toys, carpets, rugs, bed sheets, wall paint, car dashboards, and in dust after tobacco has been smoked, that are re-emitted into the gas phase or react with oxidants and other compounds in the environment to yield secondary pollutants. Third-hand smoke contains a large amount of chemical compounds, including some not found in freshly emitted tobacco smoke. It results in involuntary inhalation, ingestion, or dermal uptake of pollutants in the air, in dust, and on surfaces. Health benefits of quitting smoking. Within minutes, blood pressure, pulse rate, and the temperature of hands and feet will return to normal. Within hours, blood oxygen level has increased to normal. In 2 to 3 days, sense of smell and taste will return to normal. Breathing becomes easier. In 2 weeks to 3 months, the heart attack risk will start to drop. Chronic cough disappears. Insulin resistance becomes normal. In 1 year, the excess risk of coronary heart disease and stroke has dropped to less than half that of a smoker. In 5 years, the risk of subarachnoid hemorrhage has declined to 59% of the risk of smokers. Economic benefits of quitting tobacco smoking. Money spent on tobacco, healthcare costs due to tobacco-related illnesses, minimization of opportunity cost, decreased absenteeism from work, improved productivity. Social benefits of quitting tobacco smoking. Improvement in quality of life, improvement in social interactions. Children are less likely to start smoking and more likely to quit if they are already using it if parents exhibit quitting behavior. Why do people smoke or use tobacco? Why don't they quit? Addiction to tobacco as a social activity while having coffee or tea or after a meal, relieving stress or as a mood fixer, bonding or for acceptance or sharing of cigarettes, boredom, or passing time. Nicotine's role in addiction to tobacco. A major factor that maintains tobacco use over time is addiction to nicotine. Nicotine is not a carcinogen. It is distilled from burning tobacco and carried on tar droplets. Only free nicotine crosses biological membranes. The half-life is 120 minutes. The quickest delivery of nicotine is the inhalation in the form of smoke. Nicotine has effects on brain dopamine systems similar to those of narcotic drugs such as heroin and cocaine. Positive enforcement. Nicotine increases the number of nicotinic cholinergic receptors in the brain. Tolerance. The brain and the body get used to functioning with a certain level of nicotine. It gradually increases the number of nicotine receptors in the brain, and therefore, tobacco users need higher amounts of tobacco in order to achieve the same levels of satisfaction. The nicotine levels drop dramatically 1 to 2 hours after the last cigarette. Then, craving for nicotine begins. Negative reinforcement, reducing withdrawal symptoms. The cycle of nicotine addiction. Nicotine binding causes an increase in release of dopamine. Dopamine gives feelings of pleasure and calmness. Competitive binding of nicotine to nicotinic acetylcholine receptors causes prolonged activation, desensitization, and upregulation. Features of nicotine dependence: craving, a strong desire to use nicotine, withdrawal symptoms, increase and regular use, difficulty in controlling the use despite knowing the harmful effects. Nicotine withdrawal symptoms is a group of symptoms that may occur from suddenly stopping the use of tobacco. Withdrawal is the adjustment of the body to live without nicotine, and it is the physical and psychological adaptation to living without nicotine. Nicotine withdrawal symptoms are also known as recovery symptoms. These symptoms are usually temporary. These can be a major barrier for attempting to quit and also its continuation. Common nicotine withdrawal symptoms are headache, restlessness, insomnia, mood changes, coughing, cravings, difficulty in concentrating, and influenza like symptoms. Summary: tobacco use not only causes a burden in the local context but also in the global context as well. Tobacco contributes to more than 10% of all deaths in Sri Lanka. It can impart many health consequences, including cancer. Secondhand smoking is also a significant threat to health of a person. Quitting will enable reversal of many of the health consequences, some within a very short period. Doctors must be aware of nicotine addiction and withdrawal symptoms in planning interventions. Thank you.